Hey, young America, we need to talk. You may think this is uncool. You may even think it is bogus. But I want to tell you about something that has everyone buzzing. Something that concerns mature boys and girls just like you. Something called grass. Not that grass. I'm talking about marijuana. You may have heard of it. You may have seen someone smoking it, like those burnout bohemians or that crazy-eyed custodian at your school. You may have taken a toke or two. But do you know the whole story? Do you know the blunt truth?
Some may say the legalization of marijuana is a joke, but this plant is no joke at all. And our government is very well aware of this. Legalizing this one plant can not only help our citizens medically, but it can create jobs, feed the hungry, save taxpayers, cut back waste, and so on. However, miles of red tape, laws, and litigation fence us off from truly using this commodity to its full potential. This is because your federal and local governments know this plant opens the door to individual independence, wealth, and well-being. And trust me, these fat cats aren't interested in narrowing the gap between you and them. So why don't we just remove all the red tape, laws, and excuse my language, but the bullshit that stand in between us and marijuana.
To one mother and her controversial treatment for her son's autism. She says medical marijuana baked into brownies not only changed some profound behaviors of her child, but also saved his life. She's speaking out for the first time on network television here with us this morning on GMA, and we will hear from her in a moment. But first, more on her story.
Let's go. Let's go.
Today, 10-year-old Joey Perez is thriving, but his mother Miko believes it wasn't conventional medicine that cured him of some of the severe symptoms of autism. Instead, she credits these brownies, baked with a controversial ingredient, medicinal marijuana.
Any kid would love brownies, Mom's brownies.
She believes the drug prescribed by a doctor has saved Joey's life. Before the treatment, she described him as hostile and dangerous, and his weight dropped to 46 pounds.
You could see the bones in his chest. My son was going to die.
Within weeks, she says he relaxed, made sounds for the first time, and gained 38 pounds. He went from taking 13 different kinds of medicine a day to just 3. Joey's psychiatrist warns marijuana is not a cure for autism, but says its effect on Joey's brain triggered hunger and altered his personality for the better.
He was clearly starving. He had droopy eyes. He had very poor eye contact. After he had began the medical marijuana, he was very bright-eyed and smiling and laughing. He was just a totally different boy.
Miko isn't the first parent to use cannabis to help their autistic child. A mother in Rhode Island blogs about giving it to her 9-year-old boy in his cookies and tea. And the parents of Sam, a 10-year-old California boy, claim the medical marijuana they put in his melon has worked wonders.
There are diagnoses at near epidemic proportions for kids in this country: ADD and ADHD, attention deficit disorder, and attention deficit hyperactivity disorder. Fair or not, they are so common as to become part of the vernacular, referring to our collective short attention spans and inability to focus. Don't mind him, he's got ADD. According to a member of the American Academy of Pediatrics, when our nation's doctors encounter a patient with one of these disorders, they go right to one drug, methylphenidate. You may know it better as Ritalin. But there is a lesser-known treatment, one that may, in fact, be more effective with fewer side effects. Cannabis. You may know that better as weed, reefer, Mary Jane, marijuana. Dr. Claudia Jensen is a clinical instructor at the University of Southern California and a practicing pediatrician who advocates the use of medicinal marijuana for the treatment of ADD and ADHD. Dr. Jensen, good evening.
Hi, hello. How are you?
This is something you feel strongly about. You even testified before Congress a few weeks ago on the use of medical marijuana. What led you to the conclusion that this is a viable treatment for this disorder?
That's what patients reported to me, so I listened to them. And I started paying attention and asking more questions when I did patient interviews. Seems to be rather consistent. They keep saying it over and over again.
There are parents who are no doubt thinking as they watch this, without any kind of analysis or any kind of medical explanation or the expert testimony of a doctor who has listened to patients, that makes no sense to them. The idea that they are fighting on one front the influence, the pernicious influence of marijuana in a teenager's life, a kid's life, and yet you are here saying that this can be of enormous value in treating this rampant and life-constricting disease. How do you respond to people who have the knee-jerk reaction, how could this possibly be any good?
Well, first of all, you're right. This is a potentially life-debilitating condition for a lot of children and adolescents. They become very angry. I think the answer to that question is that it needs to be evaluated by a physician before it's recommended to a child or an adolescent. And the truth is that one of the reasons that adolescents have an increasing use of cannabis and marijuana in this country is because they've been lied to. They've been told that this is a very dangerous drug and that it has no benefit. And unfortunately, that's not what they experience in the streets. And I think it's more appropriate to bring it up out of the streets and into the doctor's offices so that children and adolescents and parents can learn the truth, get some of the data, and look at this drug not with a reefer madness perspective, but more with a scientific and factual perspective.
How would you administer this to children at what age? And I'm presuming that the means of dispensing would be primarily those other than smoking it. Am I correct?
That's what I primarily recommend, particularly with ADD and ADHD, because smoking marijuana has such a short duration. It only lasts an hour and a half to 2 hours. Plus there's the stigma of the child smoking anything, but smoking pot is a difficult social issue to deal with. When they ingest cannabinoids or cannabis compounds, for example marijuana, it lasts a lot longer. They can get all the way through the day with a single cannabis cookie or a piece of toast with cannabis peanut butter in it in the morning before school. They don't have to get stoned, it's dose related, but they do get the benefit of being able to focus and pay attention, not be impulsive, not be angry, be peaceful and relaxed, and pay attention in school, which helps them get better grades, which is the important issue. Anything would work. Dr. Claudia Jensen from USC, many thanks for your time.
Oh, it's a miracle. I mean, I was almost helpless.
Mabel Naser is 82 years old. At one point, she was taking as many as 17 prescription drugs for pain. Now, she just takes her heart medicine and a medical marijuana cocktail twice daily. Mabel didn't like the idea of medical marijuana.
Oh my, I thought that was horrible.
But after seeing media reports, she thought it might keep her out of the nursing home.
If I can find something that will make me quit hurting, I'll take it. And that's just what I'm doing.
Mabel says she's far more lucid now that she's off the narcotics. Before, she could barely walk to her door. Now, she walks around the block. But Mabel's primary care physician expressed concern that medical marijuana would complicate her conditions. In a letter to Mabel, he said if she continued marijuana use, he would have no choice but to dismiss her from his practice.
It is a major challenge for patients around the state to find a physician willing to recommend. Unfortunately, a number of physicians in the state are restricted from providing a recommendation to their normal patients because of where they're currently employed.
If you want to convince me or anyone that marijuana is a joke and harmful to this country, then you'd better make pretty damn good account for the tens of thousands of diverse in age and demographics who swear by it every day. And then the ongoing successful medical research that continue to find more safer and effective uses for it.
Cannabis is found in every major materia medica that has ever been written. It was included in the United States Pharmacopoeia from 1854 until 1941. The founder of modern medicine is a physician named Sir William Osler, who was prominent around the turn of the 19th to the 20th century. He wrote the first textbook of internal medicine, and in that textbook he said that cannabis was the most effective medication for the treatment of migraine headaches. The first modern research that was done on cannabis was done in 1949 that demonstrated its usefulness in treating epilepsy. I have a number of people who don't have epilepsy when they use cannabis regularly.
Cannabis is remarkably well suited to our anatomy and physiology, even in the event one smokes it.
Marijuana was widely used in the 19th century for the treatment of asthma. And in the 1970s we found that marijuana has a bronchodilator effect. It's because of the THC in marijuana. What is the evidence that marijuana smoking, habitual marijuana smoking, can lead to lung cancer? With respect to the development of lung cancer, we found no evidence of any increased risk of lung cancer occurrence in association with marijuana smoking alone. The THC actually has an anti-tumoral effect. And these are studies that were done both in experimental animals and in cell culture systems, and for different kinds of cancer. For lung cancer, breast cancer, thyroid cancer, prostate cancer, gliomas, brain cancer, that the development and growth, or the growth actually of the tumor is suppressed by THC, and metastases are also suppressed.
There was a study done on AIDS patients by Dr. Donald Abrams of UCSF to specifically determine whether or not the use of cannabis had an adverse effect on AIDS patients. And rather than finding that it had an adverse effect, he found that it had a favorable effect and that it counteracted AIDS wasting syndrome. Cannabis is useful in relieving people's pain. People are able to decrease the amount of opiates that they're taking, and in some instances to stop taking opiates entirely for pain control.
Antioxidant, anti-inflammatory, smooth muscle relaxant. It's also an antispasmodic.
It's particularly effective in relieving pain from connective tissue disorders, from arthritis, from fibromyalgia, from systemic lupus, from reflex sympathetic dystrophy, a whole host of conditions that we don't really understand very well. People seem to get a good relief from cannabis.
From a medical viewpoint, cannabis has no overdose potential.
It's helpful in dealing with the anxiety of people that have Alzheimer's disease. It's helpful in dealing with the muscle spasms that are associated with Parkinson's disease.
Cannabis has an unexcelled record in terms of providing safe and effective sleep.
We did a little study of people with Crohn's disease and found that many of them were able to stop using steroids and stop using other medications that they had taken for their Crohn's, that they had less diarrhea, they had less abdominal pain. It was a true miracle for them.
Marijuana has proven to greatly reduce pain, cure loss of appetite, safer and more effective for ADD and ADHD, treat bipolar conditions, asthma, diabetes, optical disease, skin conditions, PTS, multiple personalities. The list goes on, and without any harmful prescription and no unwanted or long-term side effects. Recent studies have also shown that not only is marijuana a great treatment for Alzheimer's, but it slows and in some cases even reverses the disease as well. Imagine if your sick family member could remember yours and their names and faces again, easing family suffering, expenses, and adding a bit more quality to living with this terrible disease, and for pennies compared to the high-priced prescriptions.
It's always a good controversial topic, I think.
Oh, really?
Yeah!
What's the controversy?
Okay, on Friday, the federal government officially declared that marijuana has no medical purpose, and it's going to stay classified as a dangerous and addictive drug, just like heroin. And now